to reduce the transmission rates. So we're really happy to be able to make progress in that regard. These programs are funded through the federal CARES Act dollars that have been allocated to the states. So this money originally comes from the federal government. And it's the right thing because we know COVID has taken a disproportionate toll on immigrants and communities of color, certainly in the agricultural industry. And we know that these communities and their laborers contribute far more than the $40 million that we're putting into this fund. The Nonprofit Institute on Taxation and Economic Policy estimates that these undocumented workers contribute more than $300 million in state and local taxes annually, just in our state. So this is the right thing to do, the smart thing to do, and the healthy thing to do for everyone in our community. The $40 million fund will be distributed later this fall once we have secured an entity to manage the program, and we're currently accepting proposals in that regard. The $3 million fund will be run through our Department of Commerce to ensure that businesses provide sick leave and are reimbursed for it. This essentially provides that the employers will be reimbursed for the sick leave they provide their employees. So it's a pro-business activity as well. I mentioned these programs comes from CARES Act funding. To date, we have distributed more than $1 billion in CARES Act funding to local governments statewide to fight the impacts of COVID in their communities. And we now are considering the next tranche that will go to local communities and local government entities to help with them. There's a meeting this afternoon and the upcoming days to try to take the next steps in that regard. With that said, I'm joined by Dr. Kathy Lofi of our Department of Health today and Dr. Francis Rito, who's a doctor of infectious disease at Evergreen Hospital in Kirkland. I've asked Dr. Rito to join us because he has treated many individuals with COVID-19 since the pandemic began. He's right on the front lines of this pandemic, and I've invited him today to discuss his experience along with the emerging data and concerns about the complications, which are long-term complications at times associated with COVID-19. We know that the medical community is still learning a lot about this disease. They're learning a lot about its long-term complications. In a study recently published by the CDC, about 35% of COVID patients surveyed said they had not returned to their usual health when interviewed 2 or 3 weeks after they had a positive test. And here's kind of an interesting one for the younger folks amongst us. Among persons aged 18 to 34, including those, or specifically with those who had no underlying health condition, 1 in 5 had not returned to their usual health. Now, in contrast, more than 90% of outpatients with flu have described themselves without problems after 2 weeks. We are not dealing with the common flu. We are dealing with a deadly disease that has long-term complications, including at times with people in our younger generation. So the emerging science indicates that taking it seriously has been the right thing to do in Washington and will continue in the foreseeable future to be the right thing to do. So this is obviously taking on increased importance as we care about our young students. We know we would like to get back to what you consider normal school years, but we know we have to care for the health of our kids, considering the long-term science implications as local districts make local decisions. So we have Dr. Rito, and Dr. Rito, I'd like to know if you can share some of your observations that could be useful for people in their own individual lives.
Thank you, Governor Inslee and Dr. Lofi, for asking me to participate. It's been about 5.5 months since our initial 2 patients were diagnosed with COVID. And since then, we've had hundreds of patients locally here, thousands in the state, millions in the United States, and of course around the world. And associated with that has been some very significant suffering and unfortunately a lot of deaths. What I'd really like to focus on here are some of the advances, the learnings that we've been able to come up with over the last 5.5 months. And they really come down to 2 measures. One is prevention, The other is treatment. And in the prevention side, on the prevention side, we have really refined some of the epidemiology associated with this, the who, what, when, and where. And we can thank Dr. Jeff Duchin and Megan Kay and Dr. Lofi of the Department of Health, as well as the Centers for Disease Control, for their really tireless efforts to establish this baseline sort of information. In terms of treatment, the clinicians involved early on realized that this was really a different entity. This was not just influenza. This was a virus that infected a number of different tissues, and we were seeing patients with heart manifestations, gastrointestinal manifestations, neurologic manifestations, and it was really a complicated process. And to that end, we learned that it was better not to put people on ventilators right away, that turning people on their stomachs actually helped them breathe, and using non-invasive mechanisms for breathing was more effective. And with this, some of the very first non-pharmacologic interventions provided us some background and some hope that we could change the trajectory. Of course, the studies that were ongoing here with the National Institutes of Health allowed us to confirm that remdesivir, an antiviral, was effective in hastening improvement and didn't quite show a mortality benefit, but was very close. And that was the first antiviral that's actually been shown to be effective in the treatment of SARS-CoV-2. But I think just as importantly, we've learned that there is a very inflammatory reaction associated with this. And using treatments that will modulate the immune system are critical and important. And investigators in the United Kingdom showed us that steroids were actually a benefit, which was not the case for other types of viral infections. And finally, I think it's important to recognize that while it's important to show what does work, it's just as important to take a look at agents that have been proposed and don't work. So numerous studies showed ultimately that hydroxychloroquine was of no benefit, and other immunomodulators may be too narrow and too targeted to be of benefit. So it's important when you look at this aspect to understand what the disease is about and the early interventions, both with medications and with non-pharmacologic interventions, what you can do. Ultimately, of course, we can only prevent this, and that prevention will become when we're immune or we have an effective vaccine. And we're working very diligently towards that target. In the state of Washington, Dr. Lisa Jackson at Kaiser, at their Vaccine and Therapeutics Evaluation Unit, was the first to initiate phase 1, phase 2 trials of a vaccine that has now entered broadly phase 3 testing. A number of other vaccines are being trialed in the United States. And once we have an effective vaccine, we may be able to decrease the incidence and perhaps even the severity of infections. But perhaps I should really mention what we're seeing now afterwards. And we're seeing patients coming into clinic 4 weeks, 6 weeks, 2 months, even 3 months after their infections, complaining of debilitating fatigue, persistent headaches, muscle aches, difficulty concentrating, and even changes in their sense of smell and taste. And this is peculiar. We don't see this with other viral infections. So it's something that we've taken note of, and we hope that people improve because there's quite honestly very little in terms of therapy for this. So the message we have here, and this is for all the healthcare workers here at Evergreen, but around the state, and there are tens of thousands of people who are involved in taking care of patients, not just the doctors and nurses you see, but really all the people that work behind the scenes to make these hospitals and clinics run. Thousands, tens of thousands of healthcare workers. It's really, we need your help to slow this down. And we want everyone to be proactive in their prevention efforts to minimize the spread and the transmission. This is a public health message, but it's really a personal message of accountability and responsibility. And we need the help of everyone involved to stop the spread. We ask you to do your part, and to that end, wear your masks because it's been shown to decrease transmission and infection. Wash your hands, socially distance, physically distance from other people. And please, if you're ill, don't go to work and expose other people. So common sense methods. And we've already seen a dramatic impact on other viral infections just with these simple measures. So they do work, it's effective, and I think we can undertake that effort to do our part to help the healthcare workers and minimize the risk of others. So Governor Inslee, I'm happy to pass that back. I understand we'll have questions later, and we can entertain those.
Thank you, Doctor, and I hope you'll thank your colleagues, your nurses, your physician's assistants, your engineers, everybody at your hospital. They were on the front lines of this. They have been courageous, and I want to thank you, and please pass that on to your colleagues. And I think all 7 million Washingtonians understand the heroism of our medical care workers right now. By the way, I do want to touch on something, this issue of masking. We're having good results with this. I was told maybe it's 99 or 95% usage in Yakima, maybe it's 70% in Okanagan and climbing. And we're seeing success in Yakima where we think we're driving the numbers down of infections because of masks. So this message is that this works, and it saves not only lives, but long-term problems that Dr. Rito has talked about. So thanks for everybody for helping out in this effort. I'd like to touch on a couple things pertaining to democracy before I take questions. I hope people will to continue to fill out their 2020 census documents. There's so much writing on this, representation in Congress, the ability to get federal assistance, and that depends on our ability to be treated fairly by Uncle Sam, and that depends on the number of people who fill out our census documents. The deadline's been extended through September 20th, so I hope you make sure you're counted, and you can check it out at www.census.gov, www.census.gov. We need to be counted. We need to be treated fairly in Washington State, in Washington, D.C., and this is the best way to do it. Now, there is something I want to share with Washingtonians that I'm very disturbed by. We are very proud of our state in so many different ways. We have led the nation in so many ways with first long-term care plan for our seniors, the best paid family leave, the highest minimum wage, some of the best clean energy laws in the country, best financial aid package for our students in the country. And we have one of, if not the best, voting systems in the nation. We have led the country in this in so many different ways, with early registration for young folks, with motor voter, with same-day voting registration, and most importantly, the very successful mail-in ballot that we enjoy in Washington State. And this has been a bipartisan success. Republicans and Democrats have enjoyed this for years now with tremendous success, with essentially no problems, an increase in voter participation, and the joy and comfort of being able to vote from your home and put it in the mail. We're very proud of this. We can show America that this works. But I have to share some disturbing news with you, and that is we have someone in Washington, D.C. who is trying to hijack our mail-in voting system, who is in a full-scale assault on mail-in voting, and is trying to pull the rug out beneath a fundamental part of democracy, which is voting. And that's unfortunately the President of the United States, who is trying to sabotage mail-in voting by degrading the ability of the U.S. mail to do its job of delivering these ballots. This is extremely concerning. And I think we've seen that this is not an idle concern. The President has convicted himself of this from his own lips when he made it clear in a statement that the reason he has been trying to degrade the U.S. Postal Service is to prevent people from successfully enjoying mail-in voting. This is one of the most grievous assaults in democracy I've seen in my lifetime, and I hope and believe it will offend both Republicans and Democrats and independents and whatever other party you belong to, because it has been such a success in Washington state. And this argument that somehow it's full of fraud is just a bunch of bunk. It's absolutely untrue. And everyone from a Republican Secretary of State to Republican legislators to Democrats all across the state of Washington know that's the situation. So we have to stand up against this. I've been in talks with Attorney General Bob Ferguson today, who shares my view that the president's actions are harmful and undemocratic, and he is now considering what our rights to be in Washington state. We believe these actions are unlawful. I believe it will hurt residents of our state and others. And just give you an example, as a result of the president's policies, it's possible that people who register 8 days before the election wouldn't be able to get their ballot on time. So we know we've had an excellent track record of challenging unlawful actions by this administration. The Attorney General and his excellent team have now, their record is 30-1 against this administration, and we'll look forward to whatever decision he makes. So with that, I was happy to stand for your questions.
All right, first we'll go to Rachel. Rachel, go ahead.
Governor, as of today, at least 5 states have decided to move forth with the president's executive order on partially extending unemployment insurance. I know your office has been awaiting additional guidance this week, but are you any closer to a decision on what, if any, version of the plan offered could be implemented here?
We are still waiting for clarity. The administration has not provided the clarity we need to consider whether this could work in the state of Washington. We do have very grave concerns that it is not adequate to the needs of Washington families in many different ways. One is that it is a 50% cut in the benefits the federal government would offer as far as federal dollars that they are contributing, and a 33% cut to the benefits potentially to Washingtonian families. And we think that the economic conditions do not justify the federal government cutting, reducing, degrading the ability to support our hard-hit families during this economic downturn. That's just for starters. Second, the method that he has proposed runs out as soon as the disaster fund runs out, and that could run out in a matter of weeks. This money could be gone in a matter of weeks. So it is not a long-term solution. Third, and this is a little bit unknown at the moment, but it requires the state of Washington potentially to dip into the reserves that are meant to take care of people's health and meant to take care of people's testing and meant to take care of small businesses. So for a lot of reasons, we're not pleased, to say the least, about what is happening. We need a full, fair continuation of the unemployment compensation that Washingtonians have had for the last few months. That is the right thing to do. Now, to do that, we need Congress to pass a relief package that will actually do that. And we hope that those talks will continue to reach fruition. Now, we are considering our options. We would like to know if Congress is going to act, and we need further clarity about the rules that the administration potentially could apply to see whether this makes any sense for us to move forward or not. But one way or another, we need to get additional unemployment compensation for the stressed families that are in such tremendous economic stress right now. And frankly, it's kind of galling to me that when we have so many families that are worried about how to pay the rent, how to pay the mortgage, how to put food on the table, for goodness sakes, that we still have not had a package that would simply continue the existing unemployment compensation. Look, all we're asking for is don't break the system, Mr. President. simply continue the existing level of benefits. Because I can tell you from the thousands of Washington families that are worried about where the food's coming from right now, the need for unemployment compensation has not been decreased one iota in the last several months. So I don't know why the president would propose cutting these benefits.
Rachel, did you have a follow-up?
I do. Governor, some of the states are opting to take the option where the state doesn't have to chip in, which would result in $300 a week for claimants. So why not go that route as a stopgap option while continuing to wait for congressional action in order to get some additional money to people now?
We need to have clarity from the administration whether they really mean that, number one, because we're getting different messages from the administration, which has been the situation frequently, unfortunately, in this administration. We also want to point out that this would not help all the benefits, all the beneficiaries. For those who would not have $100 of benefits, this would not be a solution for them. So we're trying to figure out what the administration really means by what they've said so far. So we need further clarity to be able to answer your question.
Okay, next we'll go to Ryan with the Seattle Times.
Yeah, hi, Ryan Blethen with the Seattle Times. I wanted to follow up on something that was touched on at the DOH COVID briefing yesterday. For a couple of weeks now, there's been some problems with getting the negative results posted, and that's affecting the positivity rate. Can you tell us, I think, your office is seeing that raw data. So can you tell us what the positivity rate is and what the trend looks like? And if not, if you're not seeing that, how can the state, how is that affecting the state's response to the outbreak?
Kathy is on the line.
Yeah, well, fortunately, we are confident that we know the general nature of the positivity rate, which has been relatively stable, and the delta between getting the exact number is not large enough to really affect our decision making. So the good news is we have a good enough handle on this to have confidence that we're not in some doubling of the positivity rate. That is not the case, nor is it cutting in half, which we wish it would. So we're pretty much in a stable position, and we always want to have the most accurate information, and that still is being worked on. But we feel good about the information we do have. We're also pleased, obviously, that some of the case counts, the positive numbers, have been coming down, and that is a certainty. There's no uncertainty about that, so that's good to know. Kathy, would you like to add anything to that?
Yeah, I think the one thing I'll add is that we use a variety of different data sources, and we look at positive tests. I think yesterday I shared some information around how many people were going to our emergency rooms with fevers and coughs. We look at hospital admissions for laboratory confirmed COVID infection. We hear from our hospitals how many people are currently in their hospitals. We have death data. We use a variety of different data sources to really, outline the picture of what's happening and where we are in the pandemic. Every data source on its own has its limitations, so we never depend on one. It's like you really need to look at all of them together and to see that big picture. And, we feel like we have, plenty of data right now to really understand where we are in the pandemic.
Well, as far as the positivity, what I can tell you, Ryan, is I'm confident that we have not seen a spike in the positivity from the raw data that I get every single morning. So we're confident of that. And of course, that would be our largest concern.
Ryan, did you have a follow-up?
No, that's it. Thanks.
Okay, next we will go to Drew with King 5. Go ahead, Drew.
Governor, as you know, it's the paramount duty of the state to provide education for every student in Washington. Do you feel, honestly, that is going to happen this fall with with what we're facing, mostly remote, districts doing things they've never really done before?
Well, I think the paramount, excuse me, I think the paramount duty means that you exercise to the paramount ability within your capability to provide for the education of our children. And I do believe that we are attempting to do that across the state of Washington, because of course to fulfill that paramount duty has to take into consideration the health of our students. Now, this means that we're going to have to exercise extraordinary creativity and perseverance and diligence, trying to provide each student and as much possible sophistication and availability, educational experiences that we can. And we should do that. And I do believe we're seeing that across the state of Washington. Most recently, as you know, we've released several $1 million to help school districts provide more technology, more connectivity to students who don't have it. We've also released several $1 million to help train educators in new creative ways to do remote learning. Districts are doing what they can in a variety of contexts to reach hard-to-reach children. But this is a challenge. Look, we understand this. I was just talking to the superintendent of the Okanagan, or the Brewster district, who was talking about some of the things they're doing to try to reach the hard-to-reach children, because not our children don't have the same, obviously, support system at home. So this is a huge challenge. We have to bend ourselves to it and do everything we can. But to say that this educational experience is going to be equivalent to what you consider sort of a normal on-site education, we can't say that. There's no power on earth who could say that. It's not a divine power. But we do want to do everything that's humanly possible, and we ought to do that. And I believe educators and parents and communities are doing what they can to make those decisions. Now, those decisions, as you know, are largely local decisions. We've made recommendations, but we've largely left it to the local communities that if they can meet certain hygiene, then they can have on-site learning. I think most of them, the vast majority, will decide to start with principally remote learning. And when they do so, it is our hope that for those who really have special needs for on-site learning, that districts can consider for those students with special needs to be able to provide some on-site learning to them. We're very hopeful that they will consider those options. And I think that is going around across the state.
Drew, would you like to ask a follow-up?
I do have a follow-up, and it's a different topic, but I wanted to pick your brain on it. The Trump administration is looking at rolling back rules on low-flow shower heads. Is that something that perhaps you would try to pass state legislation to re-implement that if that were the case? And what are your thoughts on removing those?
I don't know. I haven't heard of this proposal, so I'll have to hold my shower head and get back to you on that issue.
All right. Next, we'll go to Jerry with the Everett Herald. Go ahead, Jerry.
Thank you. Governor, as you know, it's going to be pretty hot this weekend, and you have said multiple times, including earlier today, that it's a continuing concern about these large social gatherings, especially with young people. So I'm wondering if will you be working to close state parks and state beaches and reaching out to communities to do the same? If not, why not?
Well, at the moment, I don't think we have any proposal to close any state parks. And the reason is that semi-intelligent people with semi-common sense can figure out how to enjoy the outdoors without infecting somebody else. It's just not that tough. You stay 6 feet away from people who aren't in your household. And if you're close or within that distance, you wear a mask. And and many people are doing that. I've been on a couple trails in the last few weeks, and people, when they cross paths, they make sure they got a mask off and they step off the trail and no harm done. We just need an ounce of common sense here. Now, where there are large congregations of people who aren't abiding by this, we need our state parks people and others to remind folks that you're putting yourself at risk and just knock it off. And I hope that will happen. Now, if you get some abnormal congregation that continues, it's possible that we would shut down certain facilities. But you know what? That just shouldn't not be necessary. People should exercise common sense, and I'm asking them to do that because lives are at stake. And we hope that that'll happen.
Jerry, did you have a follow-up?
Yes. On the topic of the spread of COVID in state prisons, what are you doing to stop that you maybe not were doing a couple weeks ago? And are you possibly looking at a further release of inmates?
Well, there is very extensive, very intentional, very sophisticated efforts underway in our state institutions to reduce the risk of transmission. And with your permission, I'll try to send you a full description of that. It involves all kinds of hygiene measures. It involves cohorting prisoners so that they're in certain cohorts. It involves trying to remove vulnerable populations to safer environments. It involves reduction of visitation, which is very difficult for families and others, but is necessary to the safety of the incarcerated individuals and the staff. It involves testing of the staff and everybody else who comes in on a daily basis to reduce the threat of transmission. It involves trying to segregate those who have been tested positive from those who have not. It did involve a release of folks in order to give us more space so people could have more space. And I think it's quite comprehensive, but the risk is not zero. We understand that. We've had losses of folks who are incarcerated individuals, and we want to do everything we can to minimize that. So I'll try to ask my DLC to give you a more thorough evaluation, but it has been, I think, very strategic. And so far, knock on wood, it has been relatively successful. Now, any loss to a family is tragic, and we've had some. But relative to other institutions in other states, we're doing relatively well in this regard. So we're going to continue these efforts, and I'll try to get you a more full description from my Department of Corrections.
Okay. Next, we'll go to Austin with Northwest News Network. Austin, go ahead.
Oh, hi, Governor. Going back to this issue of mail-in balloting, you mentioned there could be an issue with ballots not getting to people on time. If counties had to pay first-class postage to get the ballots out in a timely fashion, are there state funds available for that? How would that work, or would that be on the counties to fund that?
I don't know the answer to that. As you know, the state has previously, I used emergency funding to pay for postage a couple of years ago. Would that be possible? Perhaps. Is the CARES money available to do that? Perhaps. But this should not be necessary. There's no reason to have a president of the United States who works for us hijack our election. There's no reason to take away mail-in ballots from Republicans or Democrats or independents in the state of Washington. It's something that's enjoyed equally and frankly admired equally. There is no issue in the state of Washington about the mail-in ballots. Zero. Zippo. And to have somebody try to intrude on our electoral process in our state, all of us ought to be outraged by it. And all of us have to stand up to stop it.
All right. Austin, did you have a follow-up?
Just very briefly, I'm curious if you yourself were a victim of this unemployment insurance fraud that was widely perpetrated on people in the state.
We do not disclose information of that nature. It is private for all state employees.
Next, we'll go to Jim with the Spokesman Review. Go ahead, Jim.
Governor, I'm wondering if you have concerns on reopening plans for private colleges, particularly those in Eastern Washington like Gonzaga and Whitworth, who are bringing students back for in-person classes this fall and have plans to have freshmen double bunking in the dorms.
Well, I mean, do we have concerns? Yes, everybody should be concerned all the time, everywhere, in any circumstances where people come into contact with one another in a congregate setting without masks within 6 feet. That's a risk factor. Now, in order to open, all of these institutions have to meet a minimum hygiene standards regarding distancing and masking and the like. So if they open, they will have to comply with requirements regarding hygiene. And that's a good thing that they would be. And if they can't meet those, then they would not be allowed to be able to have those congregate settings. But in answer to your question, yes, there are risks. And we've seen that we are now on the razor's edge. We hope we might have got this down to an R0 number of 1. But if that goes up just a tick, the transmission rate will go up and we'll have more deaths in the state of Washington. So there is reason for concern. But as of the moment, we have deferred to some individual decision-making if they can comply with our hygiene requirements. And obviously that is something we will insist upon.
Jim, did you have a follow-up question?
So would you advise the state or local health officials to close private schools and colleges if those, even if they have the hygiene plans in place, if they're not working and the number of cases goes up?
Well, we have not made a specific recommendation in this regard. We may do so in the future. As you know, in areas of high risk where we've had cases of over 75 per 100,000, in the K through 12 context, we have strongly recommended that districts not have largely on-site instruction this year. I think that probably is a general concept that would apply to colleges as well, but I have not made a specific recommendation in that regard. But look, we've got really high concentrations in a lot of places in the state of Washington. Okanagan, Chelan Douglas, Spokane, we're very concerned about Spokane right now, about the course of the pandemic there. So there's quite a number of places where we have high concentrations, and I hope people are taking that very seriously.
Next, we'll go to Keith with Como. Keith, go ahead.
Earlier today, you had mentioned masking is improving, but you were concerned about the spread at social gatherings. Can you expand on that?
I think I understood, Keith, you're asking about concern about social gatherings. Yes, we think we've done a really good job in Washington in our social distancing, in our masking protocols in the business world, in the educational world, when we're out and about shopping or at our jobs and the like. Where we have a challenge is on the home front, in the social setting, in the times that we want to enjoy life, seeing the people we love or we enjoy hanging with or having fun with. And we think that's where a large part of these transmissions are now taking place. And it's really unfortunate because people really do a good job hunkering down and masking up when they go shopping, when they go to, an office setting or when they go to work. We're doing a good job. And people are bearing down, and we really appreciate that. And that's why we've had some relative success, and we have had relative success. The last time I looked, we had the 15th best infection rate out of 50 states. And we have avoided, again, knock on wood, so far, the huge spikes that Arizona and New York and Florida and Texas suffered. But where we are seeing the transmissions occur are when we let our hair down and go out and have a good time with our friends. Now, obviously, that's in a lot of particularly younger people because there's been a big spike in the infections in people under the age of 40. It's gone from 22% of the infections to 45%. But it's not just the younger generation. It's folks who just go out and have, dinner in their home with some friends, which seems so benign. What could be wrong with that? Well, what can be wrong is you may not know you have the disease and you infect somebody who is your best friend. And in large groups, obviously, of young people are hanging together and shoulder to shoulder on a sunny afternoon, not wearing masks. That drives us all crazy when we see that because it's so dangerous. And by the way, it is dangerous to them. As the doctor suggested, we're now seeing younger people have chronic diseases. We just lost a wonderful young man, an athlete in Pierce County, to this disease with no underlying health conditions. Everybody's susceptible to this. So it's the social setting where we really got to figure out how to bear down and help out and be alert.
Keith, you have a follow-up.
Also, yeah, I was going to ask Secretary Wiesman this yesterday. Is there going to be a time when you feel comfortable about reopening the phasing approach? It's in lockdown right now. Can you, what do you need to have it improve?
Well, yes, there will come a time. I'm very confident of that. I can't tell you when that will be. We will obviously have to see a marked reduction in the metrics that we look at, the number of infections per day, the number of new hospitalizations, the number of hospitalizations of people with COVID-like symptoms, the R0 number of the transmission rate, the positivity rate. You know, we'll have to see all of those things get more into the green category. And frankly, they're a long ways away from it right now. Look, I think I just showed you the Okanagan number. What was it? I can't remember the exact number. Anyway, it's in the hundreds. Our target was to get down to 25. And we got many counties that are in the hundreds. So we have a long ways to go yet. We are going to get there. And if I can take just a moment to talk about how to get through this. I was talking to a mental health professional the other evening while I was socially distanced, wearing a mask outside, by the way. And she was telling me that, you know, it's just we all got to figure out a way to how to get through this period, which is a difficult period. And she was pointing out some things that hopefully we can keep in mind. Number one, this is a temporary condition. We are going to get through this. I think it is highly probable we'll have a vaccine and probably therapies, many of which we're producing right here in Washington State. This is a temporary situation. And we're in a lifeboat. We're trying to get to a shore, but we're in a good lifeboat because we have each other and we know what works. And we know that we can find things that we love in life to get us through that day, to relax a little bit, and find somebody you can communicate with, even electronically. And for a while, that's going to have to get us through. And it's not going to be tomorrow. That's the other thing that I suspect can help us, is to realize that we are in a marathon, not a sprint. And when you get into a pace of a marathon, you get that right pace, it can sustain you for quite a while. And I hope people can do that. And by the way, if you are having problems, we really do encourage you to look for help. And that means a friend, it means a relative, it means a mental health professional. Please look for help. This is not a time just to be stoic, in a sense. We all ought to be there for each other, and I hope people will look for help if they need it.
All right, next we've got Alexis with the News Tribune.
For the doctors, I'm wondering if there's any specific research underway to track long-term complications that you think will be particularly informative. And if so, do you expect results from that anytime soon, or is that going to be quite a ways off?
That's a great question, and I think as we are accumulating follow-up data now on these individuals, some of those demographics will become more apparent. It's pretty clear that some of the youngest children have a very inflammatory reaction, although in general children do reasonably well. But it's also quite evident that the older you get, the more complications and the more serious and debilitating the consequences are down the line. I think individuals with comorbid conditions, whether it's hypertension or underlying heart disease, diabetes, tend to have a rougher go at it. And of course, just the elderly, because you're starting at a little bit of a deficit because of your comorbid conditions. But I think this will become more evident as we accumulate the data and follow-up visits. Early on, 5.5 months ago, we were trying to figure out what the clinical presentation was. Now I think we're at a point where we understand many of those, although we're still discovering new manifestations. But it will become clear, I think, in the next few months as we find out how people are doing. And again, a lot of this is an immune response that may be persistent or dysregulated, producing some of the fatigue, the headaches, the muscle and joint pains, the changes in neurologic function. And how long that lasts, and it's really not clear. And what the treatment options are will also be clarified with time as people try different things.
Yeah, this is Kathy. I can add that I'm just now starting to see some publications around some of the longer term complications. We have a team at the Department of Health who has been reviewing the literature every day, so I get a little summary every day of the new publications that have come out, and just starting to see some around sort of the longer term manifestations. I do expect that we're going to see quite a bit more, I think, over the next 6 months, and in terms of publications and research.
Alexis, did you have a follow-up?
Yes. As you're treating patients, which of these long-term complications do you think are particularly dangerous or particularly prevalent? Or are you seeing some more frequently than others, or not necessarily?
Yeah, I think the ones that we're seeing the most are the fatigue. It's really a crushing fatigue. This is not just, I'm a little tired, I don't feel like going to work today. These are individuals who have a hard time putting more than a couple of hours of effort into their day before they're eliminated. I think that's the most debilitating. And there's one aspect of this whole picture that I don't think we've really spent much time on or addressed, and that's the neuropsychiatric side effects. You have to understand, there have been over 150,000 individuals who died of COVID-19. That's a lot of families that are going through some significant changes in their lives, suffering, loneliness, separation. And I think the mental health aspects of this are now just becoming apparent as we move along. You know, if we think about the common flu, you get sick, you're out for a week, maybe 2 weeks, you might feel tired for a little bit longer, and pretty soon you're back to work. But the changes here are really significant. Why is that? I think part of it is there's a lot more infection. There's more mortality with this because there is no pre-existing. With influenza, there's a pre-existing condition because most of us have either been exposed or had the flu, or we've had influenza vaccine. This is a totally novel virus, so we're starting with a clean slate. No immunity, no protection, and we're seeing the consequences of that. I really stress the importance here. We can try to treat you, but it'd be a lot easier for healthcare workers if we prevented the infection in the first place. And that's really up to every individual. I cannot stress this enough. We need to take action to prevent the infection, not only for ourselves, but for our families and those around us, our coworkers.
Time for a few more questions?
Yeah, so next we'll go to Essex with Cairo 7. Go ahead, Essex.
Yes, thank you, Governor. Knowing that we are seeing a decline overall in the infection rate, are there any restrictions that you can ease in a narrowly tailored way for a particular industry or sector?
Well, we hope to, obviously, in the future. We're not doing that today, but we're always looking for ways to do things that have added flexibility that won't jeopardize health. Yes, we will be alert to those things. We have been considerably acute as to particular activities in the recent past. You know, we've opened up some faith-based operations in the last couple months. We've opened up, you know, all kinds of personal care situations. So yes, we have shown an ability to do that, and I suspect that we will as our metrics continue to improve. I don't have any today for you, What I have today for you is some news from Okanagan County that people are getting serious about this, and that we know that there's things we can do to reduce the pandemic so we can do those things. And those things are I believe, going to be happening in an increasing amount in Okanagan County. We'll try to get on top of this pandemic. So I have that good news today.
Essex, would you like to ask a follow-up?
No, thank you.
Next, we'll go to Hannah Scott with Cairo Radio. Go ahead, Hannah.
Who would like to speak to it? I'm curious, when we're talking about the longer term effects that you're seeing, do we have any information on whether that's happening in any case with people who were asymptomatic and didn't get terribly sick from the infection and maybe are just fatigued at home later when you find out? And is there any particular age group? I'm trying to figure out what kind of threat it might be to older teenagers.
I think that's for the doctors. I'm only a doctor of jurisprudence.
I'll take a stab at that. You know, one of the things we learned fairly rapidly was the rate of asymptomatic infection. And at first we thought it was around 1%, but it became evident that it was probably closer to 20%. Now, if you really ask those people carefully, you'll usually find a symptom or two. And people might just complain of a mild headache or muscle aches. I don't think that you tend to see the long-term consequences in individuals with mild infections, but again, it will be something that we'll sort out. And it's interesting that sometimes people will notice a change that they really have not connected to the infection. I made the diagnosis of COVID in an individual with just a very mild taste abnormality, otherwise was perfectly well. And that person only came to my attention because there was an infection in the household. So it is possible to see these changes, and the duration is variable. Some individuals recover rapidly and others don't. I think some of it is age-related. I mean, I think if you take a serious illness, a prolonged serious illness in the intensive care unit, it is going to take you months to recover if you ever really fully recover back to your baseline. And I think the milder illness, you'll probably be back on your feet a little sooner. But serious illness, regardless of whether it's an infection caused by COVID or influenza or a heart attack, if you're seriously ill and spend a considerable amount of time in the hospital, you are going to take months to recover from that episode.
Hannah, would you like to ask a follow-up?
I do. I have a pivot to the governor, if I could. Governor Inslee, I've heard from people on your police use of force task force who have some doubts about whether that will amount to anything, and then including Andre Taylor, who's now quit the task force. I'm wondering what your reaction is to that and how you think the task force is going.
Well, I haven't heard about that, about Andre, so I'll have to call him and see what his thinking is on this. This is early in the process. I'm unaware of anything that would suggest that we can't be successful at designing a police accountability measure that will have much more credibility and much more independence. We need to assure the community that we have independent investigations, and we need to assure the community that we have independent prosecutorial decisions. I think we're fully capable of achieving that. And the task force is going to give us some guidance on that. Now, we'll need the legislature to pass some statutes to effectuate that, but I see no reason to be pessimistic about that. Now, that's not the only thing we have to do. There need to be restrictions on chokeholds and the like. There are a host of other issues we can look at in training and accountability and contracting issues with police officers. So I remain a believer that we can accomplish significant things, and we need to do so. And by the way, I just want to also, if I can, segue on this. It's not just police accountability. I think this is a moment where we can look for ways to advance racial equity across the board in so many different areas. Look, we need better equity in the small business people that the state does business with that has much more representation in minority communities. We know that that is a a weakness of our system, and we're about year one into a multi-year effort to improve that situation. We know that we have to continue to work on disproportionate discipline to kids of color in our public school system. We know that we have to have increased availability of early child education, which is so important because there's such disparate readiness for kids when they come to kindergarten and first grade. It's just unfair to have children start behind in a situation where they could never catch up. So the point I want to make is that the police accountability issue is extremely important, but it is only one of the things we need to do to remove the legacy of racism that has infected our society and our economy. And we have to look at this as an opportunity to do that. And I will tell you, I think this is a magic moment that will allow us to do this, because the nation's eyes have been raised and the shades have been lifted, that people understand how pervasive this is. So I'm looking at this as something we can do throughout. I'm really excited about some ideas in the federal government that are being promoted by one of the presidential candidates that will invest racial justice throughout the clean energy proposals. And we can do the same thing on clean energy here in the state of Washington. So I remain optimistic of my ability, or our ability, to move the ball here big time.
Last question? So last question will go to Paul with Bloomberg. Go ahead, Paul.
Governor, your administration has prevailed in a soon-to-be-resolved lawsuit as to the legal adequacy of its regulations on employer-provided farm worker housing. But the farm worker advocates still assert that those regulations are not sufficient to prevent the transmission of COVID-19. So the advocates say that the regulations, among other things, don't adequately address the emerging understanding of the pivotal role of these very fine microscopic mists called aerosols and the role they play in transmission. So 2 parts to this question. Is there any consideration being given to change the farm worker housing rules to address this new understanding? And then secondarily, this is a tough public policy question. So if you could please discuss the difficulty of threading the policy needle between the public health imperative of stopping transmission with the critical necessity of maintaining an economically viable supply chain. What are you hearing from agricultural stakeholders, like in places like Okanagan?
Yeah, well, this is the reason I went to Okanagan, is to listen to people on the ground to see what is working or not working. And you're right. There are some folks that would like to see some changes, in particular the residential dorm rules around bunk beds, for instance. And we are not proposing any specific changes right now, but we should always be alert to look for emerging science, as you've indicated, or things that can get better. And I heard some things today that I think are useful. I'll just mention some of them. I think we need to do a better job of providing health care and medical care and observation of some of our people in the ag industry, particularly those who are positive. We've had some recent incidents there that I heard about that were not satisfactory, where, I was told that people were not getting access to medical care. But I also heard about some improvements that have been made recently to make sure that there's better communication between those who are on the orchards and the farm worker clinic, for instance. And I talked to both the farm worker clinic and the ag leaders and representatives of the labor unions. And all of them, I think, ought to be able to work together to improve that situation. Second, we need to, I believe, have greater testing to have earlier identification of potential outbreaks in the agricultural setting. And we had some, I think, a recognition from all quarters that needs to improve. So we talked about ways to do that. I was pleased that one of the large growers in Okanagan is going to start doing broad-scale testing for people who are asymptomatic in their processing plants. I think that's a good idea. It needs to be expanded. And we are helping that because we're sending a mobile guard unit of the National Guard to do testing that can help agricultural folks who work so hard in the systems. Third, we talked about the need to set up the conditions where people could isolate if they were positive. I talked about that a little earlier on this fund that we set up. Look, if you have to take 2 weeks off and you're already a low-wage paid worker, it's really, really hard to do that. So I'm glad that we have started this fund that will allow ag workers to be able to isolate much more successfully. We talked about questions about whether we could improve our ventilation rules. And I asked the labor unions if they had some proposals about ventilation. Are there things that we could require that would be understandable enough that we could help on ventilation in some of these units? And I'll look forward if they have some suggestions in that regard. So, and by the way, I am, pleased. Look, these are hard decisions we've made, but I think we've made them as well as we can based on the science and rational thought. And I'm pleased that of the 17 lawsuits, I think there hasn't been one judicial, again, knock on wood, decision which has avoided any of the rules or our proclamations. That's pretty amazing to have that kind of record. Now, that doesn't guarantee 100% forever, but that's the situation to date. And I think that's a testament to the fact that when we've made these decisions, we've listened to all sides to try to thread the needle, as your second question suggests. So how do you make a decision between the known risk of COVID, which is never zero, where two humans are within 20 feet of each other, and the need to have food for people to eat? I mean, how do you reconcile those two? They're in tension. And the way to do it is to exercise decision-making based on certain principles. Number one, you listen to everybody who has an interest in the issue. And we did that intensively for weeks to try to make the right decision. You look at the best possible science and you assemble the best possible science. You are willing to take political risks of things that, frankly, might be controversial sometimes. And virtually every decision we've made has been controversial. Fourth, you try to distribute the onus of any decision as fairly as you can so it doesn't fall on just one part of our society. Fifth, you recognize that in the real world, there isn't something called zero risk. If we're going to eat, there's going to be some risk, and that's a hard thing to realize, but it is the circumstance. And the sixth thing is you're never satisfied. You're continuing looking for improvements. That's why I went to Okanagan today. Can we improve these rules? Can we improve testing? Can we improve medical care? And I came up with some ideas that I think we can. So you try to use those mechanisms. And to date, I think we've had considerable success in our state. And again, it's because we've had Washingtonians who get science, who want to be fair, and don't want to lose their loved ones to this disease.
Closing remarks, Governor?
So if I can, just allow a remark. I know I have spent months talking to Washingtonians about how to protect us from the physical dangers of COVID. And you've heard me talk more than a few times about the necessity of social distancing and the masking and the like. I just want to address something that I hope people will think about, and that is how to care for their mental well-being. How do we get through this anxiety and challenges? Look, this is tough sledding. We're going through things we've never gone through before. This is unique in our lives, and we're all feeling anxious, and we're all tired, and we're all a little bit cranky on occasion. And some people are having some real profound challenges in their lives. And we have a lot of uncertainty right now. Look, there's things that, we can't tell the exact chart. We don't know exactly when we're going to get a vaccine. We don't know exactly when we can move through these phases. And I think recognizing that is a challenge is useful to us. But I just want to hope that people can think in their own lives about what can give them moments of joy and serenity and peace and confidence and connection to other people. And I just hope people think about a way to do that. Small little anecdote. We had a tough day a few days ago, my wife and I. We'd had a tough day. We'd had to face some of the really hard things in the COVID pandemic that people are going through, and it's really hard. I was watching a grown man cry today because he'd lost a friend over in Okanagan County to COVID. And these are very intense experiences. But my wife was watering one of our plants, and she noticed a little hummingbird up in a branch, and when she put the little sprinkler up by the hummingbird just started to preen and take a little bath in the sprinkler. For some reason, that just made our day. And I think all of us have to find something like that. And I hope people can find something like that so we can all get through this together. So with that, be well, wash your hands, mask up. Thanks a lot.